And there is constantly a lot going on with COVID and the variants. So let's go ahead and have a conversation about it. Joining me now from New Hampshire to discuss further is Dr. Marie Elizabeth Ramas. She is an MD in the area of family medicine and is also the CEO of MedRisen Consulting LLC. Welcome to BNC Live. Thank you for joining us and Happy New Year to you. How are you?
Happy New Year. Thank you for having me.
Indeed. So we are all going to wake up tomorrow. You know, this is the hope, this is the thought. And the first day of 2022, COVID's going to be gone, right? All this is going to be done.
I wish that were the case, but honestly, we are going to be living with COVID and all of the Greek alphabet for the next couple of years, to be honest.
Now, as you said, we're seeing record breaking numbers of positive test results, and that could things possibly get worse before they get better? I know that is the thought and that is the adage, but what we're seeing right now, could things matriculate and get worse before things start to slow down and we actually turn a corner as it relates to COVID and the variants?
That's definitely what we're seeing. Definitely during the Thanksgiving season, we did see that cases went on the rise 1 to 2 weeks after Thanksgiving, and we're anticipating that to be the same. As a matter of fact, here in New Hampshire, this week is usually the quietest week for our primary care offices, but unfortunately, our phones have been ringing off the hook with cases, positive cases. Unfortunately, I had a geriatric patient that just fell sick last night and had to be rushed to the hospital as a result of COVID itself and being exposed from her unvaccinated family. And so, unfortunately, we're going to have to deal with this, and we're going to have to continue with the known precautions that we know work.
Mhm. Now, some health experts think that the latest wave of COVID could peak in the middle of January. What are your thoughts on that?
That's what it seems to look like. Our friends across the pond in Europe seem to have had a peak within a 4 to 8 week span after the Omicron virus has entered their countries, and so we're looking into January, possibly February, depending on the area of the country. In New Hampshire, we're anticipating that's going to be closer to the end of January, February. But of course, we have to also measure that with the amount of vaccination rate within our states and within their subpopulations as well. We do know that the vaccination does protect against the most lethal aspect of COVID-19, being death and hospitalization. And so, although we may not be able to stave infections, but we certainly have measures that can protect us from serious complications.
And one of those measures is the CDC is actually reporting that they will soon approve booster shots of the Pfizer vaccine for kids ages 5 and older. Now, at the very beginning, when we were talking about vaccines and whatnot, kids were kind of, left out of the conversation, but now we're starting to see these types of things happen. Your thoughts?
That's definitely true. And honestly, it has always been my thought as a family physician taking care of kids and their family members that we want to make sure that people are as safe and protected as possible from the worst complications of the infection itself. Imagine that our kids that have been in school for the last couple of years have had for some insurmountable impedance to their education and to their social emotional development. And so, if we can get a booster shot for some of those students and protect them and keep them healthy for the rest of the school year, then that is definitely going to be a positive, and that can certainly help for some who have had a hit both from a social emotional development standpoint as well as an academic standpoint.
Mhm.
So hopefully that'll be sooner than later.
Yes, you are correct on that. Hopefully sooner than later. Now we got to talk about another member of the family that is still a bit susceptible here. How serious is Omicron and the COVID variants in general for children under 5 that can't be vaccinated?
Unfortunately, we are seeing many cases of kids not only with the COVID variant being infected, but this is also flu and what we call RSV season for our young kids as well. And so, what we're seeing in the emergency rooms is that kids are coming in sicker than typical, both with COVID infection under the age of 5. And for our younger kids, our toddlers, they're also coming in with flu and RSV variants. And so what's scary is that our hospitals are packed. Our hospitals are packed with folks who are suffering from COVID, but also they're still suffering from the same illnesses that we deal with in the typical winter seasons. So hopefully we'll be able to take care of those children. But I can tell you here in New Hampshire that we have had to ship some of our pediatric patients down to the Boston area or up north to Dartmouth Hitchcock to be taken care of just for sheer capacity reasons.
There's a lot to understand, and this is constantly an evolving situation. Dr. Ramas, thank you so much for stopping by BNC Live. And again, Happy New Year to you and yours.